It's news that no parent ever wants to hear. Your child has cancer. Finding out that anyone you love has cancer is upsetting, but when the patient is your own child, it seems especially cruel and unfair. However, if your child has been diagnosed with cancer, there is good reason for hope. Thanks to the arrival of new and more effective treatments developed in clinical trials, the survival rate for children with cancer improved by an astonishing 71% between 1970 and 2019. Today, close to 9 out of 10 young people diagnosed with cancer will survive. One of the most important breakthroughs in cancer research came in 1947, when Dr. Sidney Farber and his colleagues used chemotherapy to treat children with leukemia, a cancer that affects the blood. Children treated with chemotherapy went into remission, meaning their cancer cells stopped growing for a time. This was the first successful use of chemotherapy to induce cancer remission. Leukemia is the most common form of pediatric cancer. Other types of cancer that are commonly diagnosed in kids include cancer of the brain and nervous system, lymphoma, a type of cancer that affects white blood cells called lymphocytes, and 2 forms of bone cancer called osteosarcoma and Ewing sarcoma. Some forms of cancer occur only in children. They include neuroblastoma, a cancer that usually arises in the adrenal gland, Wilms tumor, a cancer affecting the kidneys, rhabdomyosarcoma, a cancer that forms in muscle and other soft tissue, and retinoblastoma, a cancer of the eyes. Scientists believe that most cases of childhood cancer are caused by gene mutations. Genes carry the instructions for creating and sustaining the human body and its characteristics. Think of a mutation as an error in the instructions. Some gene mutations are harmless, but others can increase the risk for cancer and other diseases. A small number of cancer-causing gene mutations in children are inherited in the genes a child receives from his or her parents. But the majority of gene mutations that cause pediatric cancer seem to occur randomly when cells make copies of themselves. Many early symptoms of pediatric cancers can also be caused by other, less serious medical conditions. So don't worry if your child develops any of the following, but do schedule an appointment with his or her pediatrician soon. Be on the watch for a stubborn fever that won't go away, frequent nausea with or without vomiting, easy bruising, an unexplained lump or swelling, especially if it's in the neck, abdomen, chest, pelvis, or armpits. Lack of energy, pale skin, constant headaches or persistent pain, changes in vision, whiteness behind the pupils in the eyes, unintentional weight loss, and unexplained limping. The treatment a doctor recommends for pediatric cancer will depend on the type of cancer and other factors. Some common treatments for pediatric cancer include surgery to remove the tumor, chemotherapy, and radiation therapy. Some children with cancers such as leukemia and lymphoma may be candidates for stem cell transplants, in which diseased blood cells are replaced with healthy blood cells. What's more, some patients with pediatric cancers may be able to receive new generation treatments called targeted therapies, which take aim at specific proteins and other molecules that promote cancer and may cause fewer side effects than other treatments. Meanwhile, a few forms of pediatric cancer can be treated with immunotherapy, which strengthens the body's natural defenses against cancer cells. And if your child has cancer, ask his or her oncologist about clinical trials. Enrolling in a clinical trial can give your child access to new therapies months and even years before they're available to other patients. These advanced treatments can be life-changing, and some may even offer a cure. There are currently about 180 clinical trials of pediatric cancer treatments underway or getting started around the world. Give your child and yourself the gift of hope by learning about all of his or her treatment options.